Margie North is a 12-year-old patient at a rehab center who was born with Down syndrome and diagnosed with moderate intellectual disabilities. Ms. North, Margie's 42-year-old widowed mother, has been providing a high level of care for Margie at home that has contributed to Margie's steady progress in achieving basic motor and cognitive skills, though she still requires close supervision of all activities and care for all basic hygiene needs. Even though she has made a slow, steady progression, Margie is still unable to participate in group activities at the rehab center. Ms. North has recently been diagnosed with systemic lupus and has symptoms of severe joint pain and stiffness, and has been finding it increasingly difficult to care for Margie because of the progression of her disease. Ms. North is faced with the decision about long-term care for Margie and has confided with the nurses who are active in Margie's care about what to do. In this scenario, Nurse 1 is going to discuss the solution of keeping Margie at home. Ms. North's high level of care and comfort have been an essential part in Margie's advancement, but how long can she continue with this level of care? This would be an easier solution emotionally for both Margie and Ms. North, and though it may be what is better for Margie at the time, it would be harmful for Ms. North due to the progression of her disease.
Hello, Ms. North. How are you doing today?
I'm fine.
My name's Courtney. I'm going to be your nurse today, helping with Margie. Hello, Margie.
Hi.
You coloring? Alright, so today we're going to talk about your care for Margie, right? Okay, so my understanding is that you've been taking care of Margie by yourself, but she comes here during the days and participates in our activities. And I know she has to have high level of care at home. And do you feel like you're going to be able to take care of her now that, with your systemic lupus, what have you been having, what's been hard for you to take care of her?
Right now I haven't had any issues. I've just recently been diagnosed. So now I don't have any difficulties. So it's really hard for me to make a decision as far as not being able to care for her, because right now I can, and I feel like I can offer her better care.
Right, and
But
she's been advancing with your care, I understand.
Exactly, and I know that my health will eventually prevent me from taking care of her the way that she needs. I'm just having a hard time coming to terms with it.
Alright, so you want to talk about different solutions you may have for when you get down longer the line?
I'm open to suggestions.
Okay. Well, we can talk about home help. You know, they can come out and help you with Margie and help take care of her and help her do her daily needs and her bath and feeding her and everything. And then do you have any family or friend support?
No,
Alright, okay.
it's just me and Margie.
Okay, and then there's also possible weekday care, if you'd be interested in that, where she comes and, you know, stays during the week, which is kind of like she's doing now, but stays for a long period of time and then comes home on the weekends.
Those sound like okay ideas.
Alright.
Nurse number 2 is going to discuss placing Margie in an institute. At this point, Margie is unable to participate in group activities at the rehab center she attends, but could she possibly eventually benefit from this type of care once the transition phase has ended? This solution would be best for Ms. North with her decreasing health status, but could possibly cause a further delay in Margie's progress.
Hello, Mrs. North.
Hello.
I'm Megan. I'm your nurse today with the rehab facility. Hey, Margie. She's grumpy today. Okay, Mrs. North, I know we had another nurse in here talking to you about, you know, she thinks it's going to be better off to keep Margie at home with you. Well, I just want to make sure you knew all of your options out there, and I do believe that emotionally it is going to be good for both of you and Margie to keep her at home. But I know it's going to be hard to think about it, but maybe going into another institution full time would be what would be best for Margie in the long run. Your health is going to unfortunately continue to decline and whatnot, but with it getting worse, the stress of taking care of Margie every day, her just even her daily hygiene and care is going to get rough on you. There's going to be some days where you can't do that, can't even take care of yourself. So we think that maybe now, if we start her now while she's young into going into a full-time facility, it might help ease her into it. Because one day she's going to have to anyways, unfortunately. You do have to think futuristic.
I know, and I understand these things. It's just very hard to process it all right now.
Right.
It's hard to think about placing your child in a facility.
Right.
It's a very hard thing for me to even try to work through right now. This diagnosis is so fresh to me. I'm still trying to process it all.
Which is understandable.
So I'm trying to take all my options, and I want to do the best thing for her. It's just a hard decision. It's a very hard decision.
I just wanted to let you know that maybe we could do something about transitioning both of y'all into it. Where now she's already going to the day center during the day, and maybe we could work her into doing it just a Monday through Friday, staying full time, coming home on weekends, which would be good for both you and Margie. And this is close to home, so you could visit as much as you like, which I believe would be more helpful in her getting accustomed to the institution. But then maybe working on where it's 24/7, and then home on holidays and any special occasions, or if you want to take her out, you could on your good days.
And that does sound very good when you present it. It's just putting it into action that's going to be a problem.
Maybe this is something that you could work with Margie on, letting her know now that talking
There's
to
going
her
to be
about
some
it.
changes.
Don't just throw it on her. She's going to need that time to settle.
Well, I really appreciate y'all coming to talk to me and trying to work this out with me and trying to do the best thing for all of us. I have some decisions to make. It's going to take me a minute to work through all of this, but I do feel that in the end I will do what's right for the both of us.
Well, good. I mean, it is a good institution. We only beat them when necessary. So. But if you need anything, you just let us know.
Do this for you and Margie at this time.
At this time, I have decided, given what you guys presented me with, all the information you gave me, I have decided to keep her at home for right now and slowly work her into the long-term care, as I know my health will deteriorate, and it will be best. It'll benefit both of us to do that. So I really appreciate y'all putting the time and effort and the care into working us through this.
I agree with your choice, and I'll win.
The ethical principles pertinent to this situation: autonomy, agreement to respect another's right to self-determine a course of action, support of independent decision-making. The nurse must let Miss North make the decision about Margie's care herself, while being available to give unbiased information and emotional support and respect in her decision. Beneficence, compassion, taking positive action to help others, desire to do good. Care, principle of our patient's advocacy. As a nurse, our priority is towards our patient, Margie, and what is best for her. We need to be advocates in her care while being caring and compassionate to her and her mother. ANA Code of Ethics. The Nursing Code of Ethics states that the nurse strives to provide patients with the opportunities to participate in planning care, assures that the patients find the plans acceptable, and supports the implementation of the plan. According to this statement, nurses should not be solely concerned with doing whatever they can to treat the patient. Rather, the focus is on developing a plan of care that is acceptable to the family. The right to self-determination. Such support would include the opportunity to make decisions with family and significant others, and the provision of advice and support from knowledgeable nurses and other health professionals. Patients should be involved in planning their own health care to the extent they are able to choose to participate. In situations which the patient lacks the capacity to make a decision, a designated surrogate decision maker should be consulted. The role of the surrogate is to make decisions as the patient would, based upon the patient's previously expressed wishes and known values. The nurse supports the patient's self-determination by participating in discussions with surrogates, providing guidance and referral to other resources as necessary, and identifying and addressing problems in the decision-making process. Support of autonomy in the broadest sense also includes recognition that people of some cultures place less weight on individualism and choose to defer to family or community values in decision-making. Respect not just for the specific decision, but also for the patient's method of decision-making is consistent with the principle of autonomy. The nurse recognizes that there are situations in which the right to individual self-determination may be outweighed or limited by the rights, health, and welfare of others.